Hi, I'm Dr. Carolyn Jacob, Director of Chicago Cosmetic Surgery and Dermatology, and I'm here to talk to you today about the new EMSCULPT Neo. It's the one in body shaping, and we're going to explain to you why. It's very, very exciting. We here at CCSD have a research division and have done research on this device, and so we're very thrilled to be able to show you the results from our clinical studies, and the new EMSCULPT Neo is here. So it's the latest innovation from the leader in body contouring. It's the first device designed to eliminate fat cells and build muscle non-invasively. How does it do it? Well, it combines two entities: synchronized radio frequency that helps to heat up the fat and get rid of it, along with HIFEM technology, which stands for high intensity focused electromagnetic energy that stimulates muscle contractions. And what those two things do together is to reduce the fat and increase the strength of the muscle to give you better looking abs. The EMSCULPT Neo is FDA cleared for non-invasive lipolysis. That's our fancy term for breaking down the fat, and improvement of abdominal tone. We're going to show you some pictures here in a minute of abdominal tone improvement on patients. However, it can also be used for other applications such as firming of the buttocks, thighs, and calves. And we're working on a clinical trial now for strengthening the muscles in the triceps. And we've been using it for the biceps as well. So stay tuned. So it's way beyond cool. The reason is that the EMSCULPT Neo shows a greater fat reduction efficacy after one series of 4 treatments of 30% reduction in fat. You're just sitting there for a 30-minute treatment. You're doing it once a week or maybe twice a week to get those 4 treatments in, and you get a reduction of 30% of fat, which is seen at about 3 months after the final treatment. At the same time, you're getting muscle building. Why is that important? We need our core to hold us together, to make us sit up straight, to make us look better with better posture, but it also looks better visibly when you've got more muscle as well. So again, these 2 single therapies are done together in 30 minutes. So what do you get? You get 30% less fat, 25% more muscle, and then a 19% reduction in the separation between the 2 big abdominal muscles called the rectus abdominis. We also found in the studies that people had up to 5.9 centimeters of waist circumference reduction. So the HIFEM technology has now been out for a handful of years, and there are over 30 peer-reviewed publications on HIFEM technology for strengthening of the muscle. There's also 7 new clinical studies that we were part of one of them, showing how the EMSCULPT Neo works. And we're going to show you a little bit about a couple of the studies. But more than 500 patients participated in these clinical trials to prove how well the EMSCULPT and EMSCULPT Neo can work for you. So we'll dab into the technology here. Again, the EMSCULPT came out first. It was the first non-invasive muscle device in aesthetics. This breakthrough HIFEM technology, again, allowed us to finally get to the core of everything to help reduce fat and increase muscle tone alone by itself. However, when you combine it with this synchronized radio frequency, it works even better. And with the Neo, there's also a different set of pulse trains. And what I mean by that is that there's these electrical pulses that you feel when you're having it done, but they've kind of upped their game a little bit with the Neo, and that helps to get rid of even more fat along with that radio frequency. The radio frequency, it works by creating heat to the tissue, and heat to the tissue helps to destroy fat, and it also helps to tighten skin a little bit. It feels very warm and pleasant when it's on your skin, and there's no need for any anesthesia, sedation, or anything. You can sit there and work on your iPad or your phone while you're having your treatment done. And what we find is that the radio frequency heating differs depending on the tissues. So if you have a lower tissue conductivity, you're going to have higher heating. And what that means is most of the heat goes to the fat. And it's more so in the fat to get rid of the fat than there is any heat to the skin or the muscle. So the synchronized radio frequency is a totally different way of doing radio frequency, which allows it to be done at the exact same time as this HIFEM technology is done. So this is a really special, interesting, very technical treatment that no one else has. And again, when this happens, you end up heating that fat tissue, as you can see those little gold bubbles there, up to about 45 degrees Celsius, which is the heat that we need to get it to start to destroy these fat cells. And this happens within the first 4 minutes of the treatment when you are sitting under the device. And it starts, again, at 4 minutes, you're starting to eat away at some of those fat cells, trying to shrink them down and destroy them for the rest of the 30-minute treatment. Then we also find that heated muscles help to also enhance blood supply to the area. And it's kind of like getting a little warm up to the area like you would do before a workout. So heated muscles are also going to respond better to the HiFem technology. So we'll show you a little bit again about how this EMSCULPT Neo incorporates both the muscle sculpting with the synchronized radio frequency. And we've done thousands of treatments with it, and hundreds of study patients were tested. And we'll show you a little bit about what we found from that. This is showing you a little bit about these pulse trains that they have, where there's some voluntary contractions, which would be what you would try to do while doing a sit-up. However, with the device, it causes these supramaximal contractions that you can't possibly do on your own. So it's not achievable with a million sit-ups, but while you're sitting there for 30 minutes, it's equivalent of having done 20,000 sit-ups. So we get faster results than exercise. Our studies have shown that 4 EMSCULPT Neo treatments activate muscle growth, supporting cells to a similar level as 12 to 16 weeks of resistance training. So they actually did biopsies of the muscles to show that they're similar to people who'd worked out every day for 16 weeks. Then also, due to the combination with the radio frequency, it's the only muscle device in the world that also sculpts the heated muscles for optimal results. And you get both hypertrophy, a growth of the muscles, and you also have new muscle fibers growing, which is called hyperplasia. So that muscle growth, again, is about 25% increase. But let's show you some of the patient results. So here on the left, you can see the before, and on the after, it's 3 months later. Remember, it takes a little time for these muscles to grow, contract, and get rid of the fat cells. On the lower picture, you can really see how this person's starting to get some definition and cut due to that increase in muscle and decrease in fat. Same thing here on a couple of gentlemen, decrease in fat, increase in muscle strength, the flattening of kind of that barrel belly, and it even affects the muscle that wraps around to the side. So even though the paddle is only sitting on the front of your abdomen, it is pulling all the muscle action even to the sides of your body. Now here's a patient who has some pretty tough skin issues with some sagging skin and laxity. And you can see at 3 months after the last treatment, some really nice tone being placed back there. Again, this is a non-surgical, non-invasive treatment, which has no anesthesia required at all. You simply sit there while you have your treatments done. The lower patient shows you really nice definition and sculpting of her muscle after 1 month after her 4 treatments. And a couple more pictures here. I especially like the gentleman on the bottom. A lot of us may have some lax muscles from sitting around and sitting too long on your couches, not walking to work anymore, etc. And this shows what a wonderful change this device can make in the laxity of the muscle and the decrease in the fat. And this is 3 months after the final treatment on that lower patient and 1 month after the final treatment on the upper patient. So let's talk a little bit about the clinical studies. I'm not going to do all of them, but I'll show you the highlights. So again, there were 7 new clinical studies with the EMSCULPT Neo, and we had 30 of us investigators worked on these together, showing you the 30% fat reduction in 3 months, a 25% increase in muscle growth at 3 months, and a 19% decrease in abdominal muscle separation. So one of the first studies was just looking at what it would do to the fat. And you can see here on the left, this is a baseline picture of fat. Those little circles are all fat cells, just like those gold balls that you saw earlier. And what you can see is 20 days after the treatment, there's intensive fat cell disruption. All of the walls of these fat cells have been broken apart, and they cannot come back. They cannot reorganize after this sort of disruption. The study that we did was looking at the efficacy and safety of using the HiFem with RF together for fat reduction and muscle toning. Did this with Dr. David Kent and, of course, Dr. Ibrahim, who's here with me as well at CCSD. We took 40 patients and looked at them after 3 treatments on the abdomen. Mind you, this was only after 3 treatments. Our goal now is to have patients do 4 treatments, but our study was only on 3 treatments, once a week, 30 minutes each, and we looked at them in 1 month, 3 months, and 6 months after treatment. They found that they had the significant fat reduction of 30.8% at 3 months and muscle thickening of 26.1% at 3 months. Again, the abdominal separation between those rectus abdominis muscles was decreased by almost 20% in our study, and the waist circumference was reduced by 6.7 centimeters. So our numbers were slightly higher than the averages I've been reading off to you earlier, but again, that's what we found in our study. And again, you can see at 1 month there were improvements of a waist circumference decreased by 3.3 centimeters, but that increased to 5.9 at 3 months and even 6.7 centimeters at 6 months without further treatments. The treatments were perceived as comfortable. Patients thought it was like a 2 or a 3 out of a 10-point scale. Everyone was satisfied with their treatment results. 90% of them thought that their abdominal appearance had been improved, and 97.5% of them thought that their abdomen was more toned. And no one changed weight during this treatment because fat doesn't weigh very much. It just takes up room. So another study was done to show about the muscle change, and we had to look at something called satellite cells. These are muscle-derived stem cells. They're the ones that are there if you're going to have new muscle development and renewal. And if you're inactive, you're not going to have any satellite cells. And if you're exercising, you're going to start to see a bunch more satellite cells. And satellite cells just have the ability to then generate new muscle fibers in you. So what they found, this is an immunofluorescence example of satellite cells at baseline, they're little red ones, and then 4 days afterwards and 2 weeks after. And you can see how many more satellite cells exist in these immunofluorescence studies at 2 weeks after treatment. So that level of satellite cells is going up, which means the amount of muscle fibers and the thickness of those muscle fibers is also going to go up. And again, in that study, they looked at this comparison with exercise programs. Again, these were done on muscle biopsies of people. They went in, they biopsied the muscle after the treatment, and they found with just 3 sessions of the HiFem plus RF in the EMSCULPT Neo that there was an increase of 30% of satellite cells. And again, this is comparable to a 12 to 16 week exercise plan, depending on which of these studies that you look at, kind of lies in between those. So it's very, very interesting. We can get you to 12 to 16 weeks of exercise after 4 simple treatments in the office that take you 30 minutes each. And again, we've got greater reduction efficacy than any other body treatment option out there, with a 30% reduction of fat in the abdomen. More pictures for you once again, just to reiterate those. My favorite guy at the bottom, that decrease in the fat and the toning of the muscle, which you would be incapable of doing with a device that doesn't address the muscle as well.